Hello, everyone. My name is Rosalie Abeng. I am an MPH candidate at the University of Nevada, Reno, and I am also an intern for the Maternal, Child, and Adolescent Health section within the Division of Public and Behavioral Health of the Nevada Department of Health and Human Services. I would like to share with you how I participated in the efforts to reduce congenital syphilis cases in Nevada. I wanted to acknowledge and especially thank the Western Region Public Health Training Center for their funding. I also wanted to thank Vicki Ives, the Maternal, Child, and Adolescent Health section, and the Nevada Home Visiting Program for this opportunity to work with them on my internship projects. I want to discuss my project's background. Congenital syphilis is a chronic infectious disease that impacts both mothers and their babies and can lead to serious health complications, including death. In the recent years, there has been a sharp increase in congenital syphilis cases. In 2018, Nevada had the highest rates of primary and secondary syphilis in the US. And since 2017, the state is ranked second in the nation for the rate of reported congenital syphilis cases. There are also disparities within congenital syphilis, and Black mothers and infants overrepresent the cases for syphilis and congenital syphilis in Nevada. For my methods, I researched, identified, and evaluated other states' action plans that address their state's increased rates of congenital syphilis. I held a presentation highlighting testing, treatment, and risk factors information to be used as resources for the Nevada Home Visiting Program. To address the disparities within congenital syphilis, and as part of my second deliverable, I developed a community engagement plan. I reviewed and analyzed nationwide existing data on congenital syphilis cases, and I integrated relevant findings to develop an action plan from the CDC's toolkit. For the Nevada Home Visiting Program, the resources that were developed and presented include syphilis testing information for pregnant persons, treatments for babies born with congenital syphilis infection, risk reduction strategies, risk factors to identify, and a call to action for home visitors. A report on community engagement strategies for STI disparity reduction, modeled and replicated after the CDC's Community Engagement Toolkit, was also developed. This action plan has the goal to reduce health disparities in STIs and achieve health equity. The plan focuses on the community's involvement to improve the community's health. There are 10 steps within this strategy, and some of these are conducting a community health needs assessment, establishing a community advisory board, training, facilitating, engaging, and supporting the community advisory board, as well as evaluating and implementing interventions. Both projects will help inform Nevada's population on the significance and impact of sexually transmitted infections. These resources can be implemented as intervention strategies. Long-term, these projects will help reduce congenital syphilis rates and eliminate disparities in the state. This concludes my presentation. Thank you.